All right. Thank you very much, Ify, for that awesome introduction. I'm sure you've given everyone, a better understanding of what Face Youth is all about. A lot of people must have been hearing about Face Youth. At least they have a better understanding of what we do in Face Youth. Today we have two awesome guest speakers. We will be starting off with Madame Tonya. She's out. Let me share her profile so that you can see what an amazing personality we have with us today. So I hope everyone can see my
screen. Yeah, eat your food. It's not your time yet.
Ify, we can hear you.
Sorry.
All right, so thank you very much. No, this is the wrong one. You are not Tony, you are Tonya. So I'll just take this one down. Let me see. Why do I have two of them? Okay. Okay, so this is the correct one. I'm correct, right, Tonya? All right. So thank you very much. So as you can see, Madam Tonya, she is a UK registered independent prescriber pharmacist, and her interest is in diabetes and hypertension management. You graduated from the University of East Anglia here in the United Kingdom, and you also founded Diabetes Consults. So that's really an awesome one, which is the first private community pharmacy for people living with type 2 diabetes and other illnesses. So thank you very much for accepting to give us this talk today. I would stop sharing so you can share your presentation, and I'll hand over the floor to you. So welcome and thank you very much. Okay, so let me know if you can share your presentation. Otherwise, I'll share from my end.
Thank you, Chinwe. Thank you so much. Good evening, everybody. I'm going to now try and attempt to share my screen. Hopefully this would work. Can you see my screen?
Yes.
There we go. So my name is Tonya Boro. Like Chinwe is calling me the UK way. In Nigeria, it's Tonya. My name is Tonya Boro. And thank you to Face Youth and Ify for inviting me. I don't want to use the hand that she sat on my head until I said yes, but I would leave that to the corner. But thank you. It's an opportunity to be here. Good evening, Dr. Chidi, as well, and to everybody else on here. So if he's asked me to speak about understanding diabetes and the impact on youth mental health, it's quite a broad topic, but I've tried to minimize it to a few slides to try and explain my concept. And I'm trying to simplify it because I wasn't sure if it was clinic. Well, I knew it wasn't clinicians, because we do talk to clinicians, but mainly for the general public to be able to understand. Mental health. I went on to ask, what's people's understanding of mental health? Because most of the times, a lot of people tend to think, especially in certain parts of the world, that mental health is mainly around when people start to go crazy. But that's not the case, and we will go through it. And I'm going to touch a little bit about diabetes as well, because I can't really talk about mental health without talking about diabetes. Um, and I did some research fact finding. According to the British Medical Journal, adolescent and young people with type 1 diabetes experience higher rates of psychological distress, periods of burnt out, being burnt out, feelings of being unable to cope with the daily burden of living with diabetes, compared to adults who are diagnosed with diabetes. Another one, the Center for Disease Control and Prevention, a research that was carried out by them showed that depression and anxiety are more common, but this is mainly around the US, US adults and young people with diabetes than those that live without diabetes. So mental health, I would like to say that everyone has a mental health, not that you have a mental health problem. Everybody has a mental health, whether it's good or bad, or you're somewhere in the middle. And mental health for me is the way that you feel on any particular day. It affects different aspects of our lives, how you think, how you feel, how you handle stress, how you relate to others, and the kind of choices that you make on a day-to-day basis. So you can see that having a mental health problem can sometimes make it harder for people to stick to their diabetes care plan, which I'm going to go into as we go on. So I decided to, before going into mental health, kind of talk a little bit about diabetes. Um, and diabetes is one of the most common chronic diseases. We say chronic because it's ongoing. It's not acute. So it's not something like, for example, I've got a cold now that it comes on and then it goes. It's chronic. It stays on in the person's life in the UK. So, obviously stays on. And diabetes is one of the most common chronic diseases in the UK and obviously around the world as well. But I'm focusing in the UK because this is where I practice. And the prevalence, obviously, the occurrence of diabetes is constantly on the increase. According to Diabetes UK, and this was 2019, so obviously this has gone forward. There's not been much more recent data. So about 4.7 people living with diabetes at the moment. 8% of these people have type 1 diabetes. 90% of these people have type 2 diabetes, and 2% have other types of diabetes. And there are more than 5 million people that will be diagnosed by 2025, which is just around the corner, and more than 5.5 million people by 2030. It's really something that's a cause for an alarm. And, according to the data as well, approximately 850,000 people are living with undiagnosed diabetes, mostly because people wait to have the symptoms rather than having regular checks. And it's until they get the symptoms that they go, oh, I've got diabetes. But there are people that are living without symptoms that may have diabetes. And there are more than 2.4 million people at risk of diabetes. That's what we call pre-diabetes. But I'm not going to go into diabetes per se in full. I'm just going to touch a little bit here and there. And here saying diabetes is a serious condition where an individual's blood glucose level, some people refer to as blood sugar levels, is too high. And I'm just correcting it that it's not the sugar necessarily that you ingest, because when you eat certain foods, it breaks down in the body and it converts it to glucose, which is a form of sugar. And it can happen when the body either does not produce enough insulin, or the body or the insulin that the body produces is not effective, or when your body can't produce any insulin at all. Um, Again, there are types of diabetes. I'm very worried that Dr. Chidi might cover some of this, so I'm just going to touch on it. There's type 1 diabetes, which we class as an autoimmune disease, which means that the body's fighting it, itself, and there is nothing these people can do about it. But their pancreas, which is the organ that produces insulin, shuts down completely. There is no insulin production at all. And these people would have to live with on insulin for the rest of their life. It is not their fault, not that diabetes is anybody's fault. There's type 2 diabetes. Sorry, there's a spelling error there. There's type 2 diabetes. Again, that has to do with more to do with certain people, genetic, and others to do with diet and lifestyle. There is also gestational diabetes, which is mainly around diabetes that occurs in people that are pregnant. And I've put on there, without trying to complicate it, ladder diabetes, which is, again, they tend to say these people are type 1, type 2, in between. They're in between. And for us clinicians, there's certain factors that might make you think this person might not be the type 2 that you thought that they were. And you have to do further tests to kind of find out if they are what we call a ladder or ladder. There's also type 3C. Like I said, these are just a few that I've mentioned. Type 3C has got to do with, people that have things to do with their pancreas. And as a result, it's now led them to get into diabetes. Symptoms, a lot of people want to know about symptoms of diabetes. They're always saying, I don't have symptoms. And sometimes I have patients in the clinic and they're saying, I feel fine in myself and you're telling me I've got diabetes. However, there are few that actually have symptoms. So they get thirsty, they can feel thirsty. You don't have all the symptoms at the same time, but you might feel thirsty, get tired. Some people complain about weight loss. Some people, especially the young, or some people feel that that's a great thing. But we say when you're thirsty, tired, and you're losing an excessive amount of weight, we need to actually, unintentional weight loss is what I want to say. We need to look into it. Needing to pass urine frequently. And in the younger, patients, sometimes some children, like they tend to wet the bed. It's not all cases of people wetting the bed that is a diabetic case. But sometimes when patients come in with their children and they say, my child has been wetting the bed when they've been able to sleep dry for nights, it's a sign that we need to do some tests for them. Symptoms of diabetes continuous. Some people would get recurrent thrush. In women, obviously, there's like a change to the discharge or itching around the vulva. And sometimes it happens once, it happens again and again. We need to look into it. In men, this can cause medical terms, balanitis, which is kind of like an itch or redness around, I don't know if they're children here, but the tip of the genital area, or stinging when they're passing urine. Slow healing wounds. Sometimes people get balls, recurrent balls, recurrent infections, blurry vision, where people feel like like they can't really see. Not all cases of blurry vision is linked to diabetes, but these are symptoms that certain people can present with that will make you think, hang on, do you have diabetes or don't you have diabetes? Sometimes people have none at all. Sometimes people have one out of a few. Sometimes people have quite a lot of these. Um, and then complications of diabetes. So diabetes can obviously lead to, we call it major and minor effects. So it can cause problems, around the heart, due to damage around the blood vessels. Sometimes it can lead to things like heart attack or strokes if it's not controlled properly. It can cause problems to the eyes, loss of sight, or what we call retinopathy or maculopathy, which has got to do with the detachment of the retina in the eye. Kidneys, again, it can cause nephropathy, which some people have difficulty clearing toxins from the kidneys. Problems with the feet where there is nerve damage, loss of feelings, people can get sores, and if they're not treated properly, those can lead to amputations. I've had people say to me, as soon as I get diabetes, does that mean I'm losing my legs? The answer is no. We can never really tell when a patient comes to us what is going to happen. But I always say to patients, as long as your management is under control and you're complying with your treatment and having the regular test, the oldest person I've treated so far, the oldest person I've treated so far is a 94-year-old that has been living with type 1 diabetes. And he's very healthy, he plays golf, and he's living his life. So I do say to people that people can live a good and long life with diabetes. Obviously, we don't want the diabetes to happen, but if it happens, we need to manage that properly. It can cause problems to the mouth. So sometimes people get recurring gum diseases, like due to excess glucose in the saliva. And that's why, especially in this part of the world, we always say ensure you actually go to your dentist. There are quite a lot of times where dentists have actually been the ones, or ophthalmologists have been the ones that are actually picked up that a patient might be diabetes because of what's happening in the gums. Complications again can lead to sexual problems, erectile dysfunction. Again, because obviously you've got blood flow to those organs, diabetes can cause damage to the nerves, like I said, and the nerve endings for men, around the genital area has got nerve endings, and that can lead to problems. The essence of this is not to cause fear in anybody, but just to get people to understand the basics of diabetes, not to treat people, but just so you have an understanding. Hang on. So yeah, again, like I said, how does all this affect the mind? Some people might think, I've had loads of people, I've seen thousands of patients. They come in and there's fear, there's anxiety, there's overwhelm. People cry, they say they're feeling disappointed, they're feeling ashamed, the whole world. It feels like I put in this picture, like everybody's pointing at you. and like you've done something wrong. And that can affect the mind. You know, people can feel like, oh my God, I'm a failure. It's because I ate this, because I ate that. It's because I ate this. It's because I didn't do that, you know, and so on and so forth. But like I said, there's so many causes of diabetes. And even if it's as a result of dietary intake or lifestyle changes that need to be made, something can be done about it at the point of diagnosis, depending on the type of diabetes that you have. So it's not the end of the world. Yes, it's easier said than done, but that's the first thing in my consultation that I do with patients. Address what they've got, but address the problems and say, it might be down to your eating habit, but it's not a case of shame and blame, but it's a case of what do we now do about it. Um, we've talked about diabetes, and I decided to talk about diabetes distress because I was just thinking about how to link mental health with diabetes. And diabetes distress, it's got to do with the emotional distress resulting from living with diabetes and the burden of relentless daily self-management. What I'm trying to say is there are people that are on insulin. They've got to take tablets. They have to think about what they have to eat. When they're going on holiday, for those who go on holiday, how do they travel with their insulin? What insurance in this part of the world do they need to take? Certain people cannot even get life insurance. They get denied life insurance because of diabetes, critical care insurance, all the insurances. When you're going on a long drive, what do you have to do? Whereas somebody without diabetes can drive for 4 or 5 hours, certain people on insulin management would have to drive 2 hours. They'll need to stop. They'll need to check their blood sugar levels because if they have an accident, they can lose their license. Some people get diagnosed with diabetes and get on insulin and they have to lose their jobs. You know, sometimes if they're lorry drivers, so all of this can cause, and you can imagine if a lorry driver is the main breadwinner for his home and he's coming back knowing that he's got diabetes, he's now on insulin, he can't have his job, that's going to affect the mind, you know, and all of this can cause diabetes distress. Um, and obviously linked to diabetes distress is social impact, stigma. Certain parts of the world, both in Africa, in Asia, even in England, there is that stigma, there's discrimination. People feel like everybody's blaming them, you know, for having diabetes. If you're from the side of the world where we're from, people say, oh, it's because you didn't eat right. That's why you've got diabetes. And I think this is mainly down to lack of understanding. You know, people have to deal with comments from everywhere. You know, if somebody's big, oh yes, it's because you're big. If someone's small, oh, why do you have diabetes? And so on and so forth. There is constant blame game, which we're trying to move away from. Financial implications, obviously, cost of eating healthy. Not everybody's able to afford that, cost of living. You're telling people to eat vegetables and eat this and eat that, whereas the foods that actually can increase glucose levels are the cheaper ones to have. So there are quite a lot of these things where people come to me and they're so frustrated because they're saying, I only have rice in my fridge. I only have rice this, or yam this, or if I deal with the Asians, they only have the pilau bread and things like that. And they keep saying the vegetables are expensive. What do you want us to do? All of this can cause diabetes distress. So in clinic, we have to unpick these things and figure out how best to manage these patients. Um, is diabetes distress constant? It can fluctuate from time to time. Most times we see it, at major events, certain periods in people's lives when they're having stress, either at diagnosis or shortly after. Like at diagnosis, you're taking everything away, and then you go and decide, you go and go through everything the clinician has said to you. There are certain people that come in to review their test results and they're leaving my room with insulin, like boxes and boxes of needles and this. And I'm saying to them, you need to inject yourself. It's a lot to take in. So all of that, can lead to diabetes distress. Changes to treatment regime. Sometimes somebody starts with one medication and it's not getting better, and we're telling them we have to increase their medication, and they're just getting to grips with taking one medication and then now you're going to another medication, or like I said, switching them from tablets to insulin because a lot of people feel that insulin is the end of the road for them. Oh, my life is, I failed. I've completely failed. So all of this can lead to diabetes distress, general stress for young people when they're under exams, their university, they have A-level results, A-level things, like 11 plus, even those who are as young as 11 years old. They're having to get their parents to say, don't eat this, don't eat that. And there's a lot of stress that goes on in the background that can contribute to diabetes distress. What I said here is if left untreated, this mild diabetes distress, which is constant and can fluctuate through time, can develop into severe diabetes distress or depression. And greater diabetes distress is often linked to medical and psychological outcomes. So people stop engaging. They start having raised levels because they stop caring. They don't want to take their medication anymore. They're like, they've had enough, they don't want to inject anymore. You can then start to notice higher levels of HbA1c, which is the test that we do here, or if they do a finger prick test, we notice that the levels are going up. Sometimes they can have low blood glucose levels or hypoglycemia where they're just injecting the insulin to say, okay, the doctor said to me I can't live without the insulin. So they're not really caring about what they eat because type 1, they have to manage their diabetes according to what they eat and then tailor their insulin to what they eat. And then also in certain cases, we can have diabetic ketoacidosis, which is a very life-threatening ailment, but I'm not going to go into that today. And I've talked about, diabetes distress to depression. Sometimes people can confuse diabetes distress with depression, whereas depression is more around a mental health problem that involves either having a low mood or losing interest or enjoyment in things. And like I said at the start, everybody goes through something at some point in their life. People lose loved ones, people have financial problems. It can cause a low mood for a short period of time. But when that starts to extend and begins to affect their lifestyle, then we can start questioning whether this person is actually depressed. Where it becomes depression if the feelings become so bad that they interfere with your daily life. So sometimes people don't want to go out, they tend to stress eat, their thoughts of suicide, and so many things like that. When it starts to get to the point where it's now gone on for several weeks and life is beginning to change, people around you are noticing, or some people have a way in which they put a face around it and they feel like, I'm just going to pretend to everybody else that I'm okay. Because most times you see people, they commit, like they have severe mental breakdowns and people saying, I didn't realize that he was going through that, because they've come up with this facade where they put up a situation where they feel like they can just cover things up. And if it's going on for several weeks or months, then obviously now we're beginning to question whether there is depression and if we need to do something about it. How can we support people with diabetes distress or mental health issues, especially around diabetes? And I've said here, even if you don't live with diabetes, is to show empathy, not sympathy. We have a way in which you say, oh my God, by the time people sympathize with you, you actually feel worse in yourself. But empathy is like having an understanding and knowing how best to support them. It might not be you that gives them advice because you don't have the right advice, but leading them to the right clinician. Acknowledging with them that there's significant daily efforts that they need to manage their diabetes. Sometimes they come into my room and they're frustrated. Sometimes I might not even talk about the diabetes. We deal with the frustrations they're feeling at the time, because dealing with that can actually help them in order to be able to manage their diabetes. Because if they don't manage their diabetes well and they stay in that high blood glucose level, it can lead to all those complications we talked about earlier. And normalize negative emotions about diabetes. What I mean by that is be more aware about diabetes so that you can help people with their negative comments. Most times people come to me and that's the next point, saying I'm useless, I can't get it right, it's my fault, I'm not, I know you're gonna tell me off, Toye, because I've been bad, I've been good. I always say let's avoid the blame game and let's just discuss how we can get things better so that we prevent problems from happening. But like I said, signpost them to their clinicians or any other. If they don't have a good relationship, they don't have to stick to the same doctor or the same diabetes specialist, or if they don't get along with that person, or they feel like they don't get the support from that person, then obviously we can signpost them to anybody. But I would sometimes say if you've been to 3 or 4 people and problem is still the same, then we need to look within and actually say, is the problem from inside or from the others that are actually treating the diabetes? There's a questionnaire that we normally do here to kind of, when things are going on and we've asked certain questions, we normally do a patient health questionnaire. This is in the UK. And we tend to ask, and I can always share the link with, Face Youth to share around, that over the last 2 weeks, we always get people to answer this on their own. How often have you been bothered by any of the following problems? If they've had little interest or pleasure in doing things, if they felt down, depressed, or hopeless, trouble falling asleep, staying asleep, sleeping too much, feeling tired or having little energy, poor appetite or overeating, feeling bad about themselves, that they're a failure or let down to their family, trouble concentration on things like newspaper, reading books, watching television, if they're moving or speaking so slowly that other people can notice that there's something wrong, or the opposite, if they're very fidgety or restless, that they're moving around so much, they can't just settle themselves, quite fidgety, and then suicidal thoughts that they'll be better off dead or hurting themselves. We ask them these questions and we get them to score it either not at all, several days, more than half the days, or nearly every day. And based on the score that they actually give to us, would tell us whether they don't have depression. So if their score out of all those questions between 0 and 4, we know they don't really have depression, and there's something else that we have to look into. If they're between 5 and 9, is mild depression. They might benefit from either having counseling, and I know that certain parts of the world look down or make fun of counseling, but it actually does really work. If they're having 10 to 14, then they have moderate depression. And that's when we start looking further into what else can we do about it. When they're 15 to 19, moderately severe or severe, that is when sometimes we would need to go in with medical intervention, so like tablets and so on and so forth. So these are questions that we normally would go through with people. And sometimes it's good for us to answer it ourselves, to just say, where am I on this scale? What's happening with me? And what do I need to do? So I'm going to wrap up here because I didn't know I called Ify to say I'm not really sure um exactly how wide or low to go with it. But I think if anyone has got any questions that they want to ask, I'm happy to take it. Thank you.
Okay, I was about typing, please unmute me now. Okay, thank you so much, Tonya. Thank you very much for this excellent, excellent presentation. Very, very informative. There is just so much knowledge that not just me, but I'm sure everybody on this platform has gained today. It has been very informative, talking about what diabetes is, the symptoms, the complications, what people are actually going through, and how we can actually empathize with them, not just show them sympathy. And so it's been really good. A lot of misconceptions around diabetes that people have other views of, you've been able to clear it up very, very nicely here. So I just want to say, on behalf of everyone here, thank you very much. I'm sure a lot of people have questions. I can see Chinedu's hand is raised. Please, can you unmute Chinedu, because I know he has a lot of things to say on this topic. So thank you very much, Tonya. A lot of people are going to have questions. You can ask to be unmuted if you want to speak, or you can put your questions in the chat box and it'll be taken up. So thank you very much, Tonya, for this. People will have questions, so be ready to answer a lot of questions from people. So Chinedu, yeah, please go ahead.
All right, good evening. Thanks for the presentation. It was very good. I really gained from it. But my question is this: there was a patient I was treating. I'm a physiotherapist, by the way. I treat patients with stroke. I was treating a patient that had a stroke, but his stroke was caused from diabetes mellitus itself. But the problem I was having with the patient was the patient was very angry, so I couldn't treat him beyond that day. I saw him the first time. The person was very aggressive towards any person that was coming to meet him. He had the capricious ulcer, and the man was very irritating to discuss with. So I don't know. In such a case, is it based on the fact that he has depression, or is it based on the fact that he has diabetes distress? Because I don't know. Could you share more light on it? Because the man was very irritating for me to even come to continue his treatment with.
Thank you for that question. I would, it's very difficult for us to say whether that person is having diabetes distress, but from the scenario that you pointed, if someone is already living with diabetes, and I suppose he would have had it for years, that is now led to him having a stroke, or according to what you said, there are frustrations with having a stroke, there are frustrations with also still living with diabetes. Now you have a stroke, we don't know what's going on. It's possible that he may be depressed, but it's difficult until we actually see him in person, and actually unpin quite a lot of things. It's difficult for us to know exactly what the problem is. But I would be more, empathetic and understanding with that patient, because obviously, he's had a lot to deal with. He's dealing with one, and then a stroke has happened. But like I always say, without digressing, is a lot of people tend to come to us the end. I still said this to someone yesterday. The mom is now having a lot of complications, and people come because when you're singing the song about diabetes and saying, let's help you, let's do something about it, because people are not getting that symptom or immediate symptom, or they feel fine in themselves, they don't want to look into it, until something happens. So it could be a frustration about everything that's going on in his life, and I don't know what's going on in his life. Here we would divert him either to we would treat the diabetes and then divert him to you as physiotherapist, and if it's something mental health related, we would then divert him to the mental health team, and all of us together will be able to manage him better. So I don't know if I've answered your question, but I tend to think that that might be more of a case of depression, but I'm not able to really give an answer because I don't know his case.
Okay, thank you.
All right, thank you very much. While waiting for questions to come in, there's something I'm trying to understand. I know that, as busy as we are with all our busy schedules and all of that, we need to check ourselves. We need to go to the hospital, check ourselves early. So when you talked about type 1 and type 2 diabetes, can you throw more light on it? Is there like, as the type 2 goes on, it gets worse? Can you break it down for people that are not in the medical line to understand better? Please unmute Tonya, please.
Right. Thank you. It's a good question, because sometimes when I start patients on insulin that are type 2, they say, so I'm type 1 now. And Dr. Chidi would probably agree with me. I'm turning to you for help, Dr. Chidi. Not type 1, like I said, is an autoimmune disease. I'm trying to find the best way. It's a bit like your body that was supposed to protect you is no longer able to protect you. It now thinks that you are the enemy. So it then feels that, you know what, rather than being a bodyguard for you and saying, like when you have infections, it's fighting infections away, it then turns against you. People will say, my village people in Nigeria, it's not the village people, your body is now attacking you yourself. And that's what we class as an autoimmune disease. There is nothing you can do about it. Your body has now turned against you. And so as a result, it starts to shut everything down. So you can imagine, this is how I do with my patients. Imagine throwing blows at the enemy, and then the enemy is being fought away. And all of a sudden, your body then thinks that, no, 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 you're the enemy. So it starts to blow itself. You're going to knock yourself out. And that's the autoimmune part of the disease. So that stage, the pancreas, which is responsible for producing insulin in our body, that's not the only responsibility of the pancreas, but that's one of the main responsibilities. You eat food, the pancreas wakes up, it brings out insulin, and then it helps the glucose to actually break down. The pancreas then shuts down. There's no insulin production. So the food that the person is eating then starts to, it's got all this glucose in the body and it doesn't know what to do with it. So now we have to then go in and give this person insulin because that insulin is mimicking what your body naturally does. And that insulin would then help the body to disperse the glucose everywhere. Whereas in type 2, it could be an onset of diabetes because of lifestyle and diet mainly. Not necessarily do you have to be on the bigger end, but yes, people who are bigger. You can have people who are slimmer, but their diet is wrong. Again, you have insulin production, but I always say that if your insulin production is this big, you would need to eat food that small so that the insulin will be able to keep up with it. However, if people are eating things or their lifestyle is so much they're having, I'm not saying don't quote me on this, but they're having full fat Coke and they're having, like rice. You know how we heap our rice when we go to, because if you want to eat for the nation, we heap the rice, there's no vegetable, and then the meat is on the corner. You had full fat Coke, maybe you drink 3 or 4, and then you have a cake. There's so much glucose that's coming out of that food, and if your body is not making enough insulin, so your body is making insulin in type 2, but it's not making enough insulin to be able to keep up with the food that you're eating. And that's why we talk about dietary changes. So we get to the point where we start with tablets, we throw in the first tablet, we throw in the second tablet, we throw in the third tablet, it's still not working. The levels are going higher and higher. Either the person has made changes or they've not made changes, and we get to the point where you're now having symptoms, your levels are getting higher, we're thinking about the complications, and we say, you know what, at this stage, we're going to take off some medications or keep some medications and add insulin, because now the insulin needs to help your pancreas. So your pancreas is there, but it kind of needs help. It's a bit like when your car doesn't start or your car is a little bit slow, you get people to push to kind of propagate that car to start. So that insulin kind of goes in there to help your pancreas to be able to, come on, I need help, because this person is ingesting so much that I need help to actually follow. Then again, you then have people who their pancreas later on in life can shut down. So those are those are what I call the latent autoimmune disease. So you have the late onset, but we kind of know those where they've made dietary changes, they've done everything, and they're just certain things that are not fitting in the box. So we would then do some extra blood tests to actually, and we tend to do, I don't know about Nigeria, but we tend to do it in this part of the world. And I'm sure, I think you're in America or Canada, Dr. Chidi, we would do what we call GAD antibodies or C-peptide tests, because those are antibodies that would tell us, is this person a late onset or is this person a ladder? And sometimes when we have Nigerians that are visiting with their parents, I often get people who are late onset, but they're being managed as type 2. But diabetes is such a complex topic that I cannot deal with it in one day, 1 week, 1 month. In such a way that I always say to people, the best thing is if you have genetic factors in your family, your mother, your father, your uncles, direct uncles, not 3 times, five times removed, have diabetes, the best thing that you need to do for yourself is at least check your blood sugars every year. Go for a blood test. People are afraid to get, and I always say, what you're afraid of is better you know it so we can treat it than actually living in fear and not dealing with it. Don't know if I've answered your question.
Oh, yes, you have. You have answered it very, very well. Thank you. Thank
Yeah.
you very, very much. That was a lot of, I was just nodding my head continuously, like, thank you very much for the clarity and all that. Thanks. Let me just look through, see if there are any further questions. I know more questions would come in. So if you have your questions, please don't keep it to yourself. She's here to answer all your questions. Dr. Chudi is here to answer all your questions as well. At this point in time, we would have a short musical interlude while you assimilate everything that has been said and, come up with your questions. Let me share briefly the slide of, where is it? Show all windows. Yeah, Cameron J. I hope she's online. If he's, can you confirm if Cameron is online, please, with you there? Yeah? If you can you hear me?
Okay.
Okay. Yeah, is Cameron there with you, please? Could you confirm?
Where's your mom's?
Okay, yeah, I can hear her then. All right, so Cameron, I would read her profile. It's quite a very interesting profile. She's a local songwriter, a singer, a dancer, and she's also a childhood and adulthood cancer survivor and a liver transplant recipient. Wow. She's worked with FACEYOUTH since April 2022 as a music tutor and an assistant tutor during the Skill Club project. And she released her first singles at the age of 12. She had since then performed on various platforms and produced new albums. So I would like to say welcome, Cameron. Thank you very much for accepting to grace us with your musical talents today. And over to you, Cameron.
Can you guys see us okay? We're at the center. Yeah.
Yes, we can.
Thank you so much. That was a great talk. I'm just gonna pull this in a little bit. Yeah, I think we're good here.
Okay.
One, two, one, two. I'm just going to sing a song that's from my EP called Bed of Roses. And it's basically a song that speaks about the love that I have for my children, and also, you know, anyone could relate it to how you feel about your own friend or mother. It's not necessarily a love song for like a, you know, someone that you're, you know, in a relationship with. It can be anyone you want to say that you appreciate, and yeah, just that you're how you feel about them. So we're just gonna make sure this is connected up here. Two seconds, tech. Connected. Okay, I like it. So yeah, this is Bed of Roses. One, two, one, two. One, two, one, two. Lying in a bed of roses, open up and close. Never let it go, so hold this. Lying in a bed of roses, lying in a bed of roses, open up and close. Never let it go, so hold this. I hope you know exactly what you mean to me. My mind, my body, my soul, free, yeah. And nothing else in this world but you and me. Walk up my name, to only teach me how you I'm sure. And only I feel it's when you struggle, I struggle. And there's time to strong. Roses, maybe some people need to go first. Never letting go of my lips. I need to get up for this. I need to know where the roses go. Open the one with the roses. Never letting go so long with this. Always guess I will. be there, you'll walk you. Oh, I really need to. It's say that it's okay when your skies are all gray. The sun shines on your face. I'm so home in your face. Open up your mind, never let it go. So whole day, simply Thank you very much, Shankar and Jane. It's been lovely to join you for this event. It was an amazing talk, and yeah, I'll hopefully maybe get to speak with you, Tonya, another time. I thought it was a really, really good presentation. Thank you very much for that.
On mute. Thank you. Thank you. Thank you very much, Cameron. That was really nice. That was really nice. I was just, nodding my head and having a good time. Thank you so much for that. That was amazing. Appreciate it. So there's a question in from Abel Canary. It says, Doctor, please, would you encourage herbal remedies, for instance, bitters, bitter cola, and others to manage sugar level?
I think this is for this lady now. Yeah.
It said doctor, is that me or is that Dr. Judy?
I guess either of you could take it up.
I'll leave that to Dr. Judy.
All right.
Okay. Can you guys all hear me?
Yes, we can hear you.
Okay. I was actually waiting to be granted the opportunity to speak. First of all, Tonya, I wish I can find the right words to express how well educated you just, made me feel this morning. Despite the fact that I've acquired a lot of information and education, but you're so good. The way you tackled diabetes, though a little bit academic, but you made it look so easy, like ABCD. So thank you so much. You're full of knowledge, and you can see someone that loves what she's doing. You can see someone that is so knowledgeable and so vast. So my appeal is to make sure you hang around this organization so that subsequently we can continue to work on the youths, because the problem we have back home, our major focus is back home. 90% of people that struggle with diabetes are undiagnosed. Then the ones that are diagnosed are spiritualized, so they always feel it's something from the people in the village, and the remaining other people will seek help in the wrong places. So they spiritualize it, they go to churches, they give them olive oil. So I'm just trying to pivot to the question Ibuka asked. So here's the deal. This is 2024. So we thank God for granting us the opportunity to be in the light. This is not Stone Age. You see, what we believe in, especially our people. It's very difficult to, put something in a closed mind. If you have an open mind, you can accept something. So we've had this culture of wanting to do things our way. Then when it gets worse, then we revert back to the people we should have actually started with. And by then it's late. So if you followed Tonya's presentation, she mentioned it's a chronic condition. Unfortunately, there are some conditions you can't fix. You're going to manage them until you go. And unfortunately for those conditions, we don't know exactly what causes them. We know the risk factors. So diabetes happens to be in that category. So diabetes is not something you just go and do something and you have a quick fix. Depending on the type you have, you can actually reverse type 2 diabetes based on your lifestyle modification. But if you have type 1, which she took time to explain, or if you have juvenile onset, or if you have gestational diabetes, there are certain things you can modify, then you will feel better. Now, when you talk about herbs, if you follow my organization in maternal and child health, you know I don't like herbs when it comes to conventional medical practice, because you have to choose between two masters who you're going to serve. You cannot combine the two. Now, the reason why I mentioned we're in the light is because this is 2024. You know, you have internet, you have access to knowledge. So you can't do something because someone is trying to brainwash you that this stuff he put in here is working. It doesn't make sense. In medical practice, we have cause and effect kind of interaction. So something led to something. And if we don't know exactly what led to that, how do we titrate the betas? How do we dose it? How many days? What are the active ingredients? So please, if you have any medical problems, don't look for shortcut. Don't go listening to the people that actually monetizing your medical condition. There are some people that benefit from your diabetes. There are some people that benefit from your hypertension. There are some people that benefit from your infertility. So they kind of tweak and, you know, they shift your mindset to believe that this is the problem. Or once you take this, you actually begin to get help. If you're taking all those beta, it's actually gonna make things worse. Diabetes is a multi-systemic chronic medical problem. So it can run your kidneys down, it can run your liver down, it can run your brain down, it can run your reproductive organs down. Like the other guy mentioned, oh, it's diabetes that led to stroke. We can't really confirm that. It might be an end-stage complications, but direct pathway, that's not the pathway. So the point I'm making is to be careful. People can easily sell you anything in social media, buy this, buy that, quick, fix this, fix that. Don't do that, because anything you got will eventually end up in your kidneys, will eventually end up in your liver. And over time, if you're already struggling with diabetes, your liver is already being overworked, your kidneys are struggling, everything in your body is struggling. So it's multi-systemic. There is absolutely no organ in the body diabetes cannot damage. So it's a big capital no. Let them be doing their business. Let people that believe in whatever believe in, and you will actually find it difficult to convince your mom and your dad, especially if they are so deeply rooted in religion, in church in Nigeria. It's very difficult to convince them that those bitters are not going to work. It's very difficult to convince them that the only thing they live is olive oil. But when you have a diagnosis in medical practice, that's 50% solved. Because if we know that this is what you have, then we can modify and begin to manage you. And if you modify your lifestyle, you can actually go off drugs. So if you have type 2 diabetes, we can over time, if we check your A1C, if you check the overall baseline of your indices, and you're doing better, we can take you off medications. The same thing is applicable to hypertension. But don't make the mistake of trying to go for a quick fix, and you're actually making things worse, because those bitters you're taking, majority of the components they use in preparing it actually also have alcohol. So you're going to make things worse. You're going to damage your liver. You're going to damage your kidneys. At the end of the day, trying to fix something you don't know how to fix. So don't go there. The reason why we show up every month is to use knowledge, more like you can see we're in the day. So once light enters, darkness will flee. So that's just what I wanted to contribute in that sense. So don't do that. You should actually be the person telling people not to do that. Thank you.
Wow. Thank you very much, Dr. Chudy. People have heard it now. Please, you've heard it from the horse's mouth. Please don't do it. Okay, so at this point in time, Dr. Chudy, I'm gonna hand you over to the audience. But before then, let me talk about Dr. Chudy. He's an amazing person. You've heard just a few minutes he has spoken, and you can see that he's an embodiment of knowledge. He's a compassionate medical practitioner, maternal and child health specialist, and also a motivational speaker. So his specialists are in maternal and child health, in women's health, and in adolescent health, community health, and I've talked about motivational speaking, and he's a life coach as well. So he would be talking to us also about diabetes. He will be throwing more light into, this topic called diabetes, elaborating more on what Tonya has told us about. So I will hand over right now to Dr. Chudy. Thank you very much. And I'll stop sharing so you can share your slides as well.
Yeah, thank you. I think before I start, Tonya, you wanted to contribute to that last question. I would like to have your opinion before I start. Please submit yourself and contribute before I go.
Thank you, Dr. Judy. I was just seconding what you're saying because a lot of people tend to think that the moment they're on medication or in insulin that they can't come off it. Just this week alone, I've seen a patient that I'm actually having to stop her insulin, but obviously check her levels because she's made changes to her lifestyle. Um, and again, it is down to education, and I've worked with her for the last 8 months, where we started her on a very high dose. She stayed on the high, in fact, started on a low dose, increased it, and then she's made changes to her diet. She's lost a lot of weight, and now from being on about 40 units of insulin, she's now on 4 units of insulin. And I'm slowly saying, okay, now we need to take you off. But what we do is we take you off, we put you on medication, and then we would check your A1C again. We work with them. So diabetes, like Dr. Chidi said, cannot be cured, but it can go into remission. Most times people do the lifestyle, get their diabetes under control, and then they forget the lifestyle and go back
Back again.
without checking. So we normally say, as long as you work with the right clinicians, going back and forth, there are loads, handful, not loads of people that have followed the right procedures if they have type 2 diabetes. But I've had patients who have type 1 diabetes. Recently, a lady lost her child in Ghana. They reached out to me a little bit too late because the child has type 1 diabetes, did not take the insulin. They didn't understand what to do with the insulin, and they were giving her herbs because somebody had told them that they just need herbs. And that's an answer to the question from, I think, Abu Canary. They gave this child herbs, and the mother is without this child today. And I'm not being judgmental to Nigeria. It's not only in Africa, but in the Asian parts of the world, we have this a lot, where unfortunately the science is not as vast as we have here. But the thing is that there are simple tests that we can actually do and seek help from the right people that actually are interested in it and can give you the right information to manage your diabetes. There is no evidence-based medicine against bitter cola. So I would not be able to say, yes, take bitter cola. If people have taken bitter cola, it could be that they've changed their diets and they've had like vegetables because they stopped eating rice. So the fact that they stop eating the rice and eating more vegetables and their sugars have dropped, in their understanding, they think it's the vegetables that has helped. Yes, it's contributed because they stopped eating the things that raise their blood sugar levels. But we cannot base any evidence on either instant bitters or bitter cola or anything else making a difference to diabetes management.
Yeah, thank you. I'm still gonna give my presentation, but I'm gonna piggyback to what Tony said. And you have to understand that anytime you're managing any chronic medical condition, it involves the interdisciplinary professionals. So diabetes is not only managed by just the endocrinologist. It relates to, it branches out even to the mental health, educators. It branches out to you. There are some situations where you will be the person that will be giving yourself the insulin. There are some situations where you'll be the person using the glucometer to check your blood sugar level and all that. And you have to understand, when we preach against, things if someone tells you, oh, someone told me this, and you don't have a diagnosis. In diabetes, there are two broad spectrum ranges. So you can be what we call hyperglycemic. When you're hyperglycemic, it means you have a lot of sugar, conventional word of sugar. It's not the white sugar you ingest. It's high. So the level of sugar in your body, it's high. The level of glucose in your body is high. Or you can be hypoglycemic. Now, people that have diabetes can be either hyper or hypo, depending on the dosaging, depending on the switches, depending on the management. So for someone that adjusted our lifestyle, and obviously the A1C is telling us, hey, this person is doing good, definitely we have to review the medications, because if we keep the medications on the high, it's going to knock that person into hypoglycemia, and that's a problem. Matter of fact, people that have diabetes are also advised to have like quick infusion of sugar, direct sugar, or energy something, because sometimes they can go down. So the blood sugar level can fluctuate to the point we need sugar to bring it up temporarily. So it's not a quick fix. It's not an overnight thing. And you have to understand that if you don't do the right things, it will shut down your whole body, including your reproductive system. There are so many men that their lifestyle is so messed up. They drink Nkwobi, they drink alcohol, they smoke, they have pot belly, they can't have babies because all these things will spiral back to affect your sperm quality. And when you don't have good sperm quality, you can't start your family. And when that happens, it can affect your mental health. You can develop problems. So it's a vicious cycle. The best thing that will happen to you is to acquire the knowledge, change your attitude, change your perception, change your practices. We are currently in a very big war with people that tell you the wrong things, especially in social media. Anybody can hop into their timeline and they begin to preach to you. They begin to siphon you. They begin to tell you things you want to hear. And of course, if you have diabetes, it would have messed you up. So whatever they tell you, you feel might be so good, you quickly want to go and jump in. And there is something we call placebo effect. So if you believe that something is going to help you, it will rewire your whole body and all those neurotransmitters to believe it's going to help you. So I can give you a bland medication. I can tell you, oh, this is the newest medication in the world, but it will give you calm. And you can actually have good outcome in whatever that didn't have any active ingredient in them because you have a placebo effect. It's rewired your mind. You're now in a good place as against the bad place you are. But we are blessed to be in the era of modern technology. And it works. Once you have a good doctor that will have a holistic approach, then you will find yourself in a better place and you won't even remember you have all this. It's just going to be part of you. So let's all be mindful of what we put in our mouth before you put anything into your mouth. Run it by your doctor and form the habit of going for your regular wellness check. Don't wait till you develop problems before you now start going, because from what Tonya mentioned, 90% of people that present at the clinic, they are already coming late. Complications have already started setting in. They're already developing retinopathy. They're already developing nephropathy. So the whole body is actually shutting down. And they want a quick fix because our people want quick fixes. But diabetes and hypertension is not one of those things you can quickly fix. You can fix it if you modify your lifestyle, if you change your attitude, if you form the habit of wellness check, preventive wellness check, attending events like this, so we can prevent things from happening. When Toya was presenting, she mentioned something about pre-diabetes. In this gathering, we have 28 people. If we take a holistic sample of these 28 people, it's possible that 20 of us might be pre-diabetic without even knowing. Now, if you haven't seen your doctor in 2023, how do you know you're pre-diabetic? And there is no one-size-fits-all for the symptoms. So you might be diabetic, and you might not even have the signs, but it's already damaging your body. So the only way to know is to go for regular checks so the doctor can keep an eye on you. And as Nigerians, regardless of where you live, form the habit of bringing out one day to visit your doctor. So your doctor can have a holistic approach of your blood works, your symptoms, your sign, and your family history is very important. If your mother had diabetes, if your father had diabetes, if your sibling had diabetes, if your first uncle, your first auntie had diabetes, you have a family history of diabetes. Now, if you begin to live your life as nobody that doesn't really know what's doing, you're going to facilitate developing diabetes earlier than you should. So by way of that, let me go to my presentation so we can talk about things we need to talk about before we go. Let me know if you guys can see my screen.
Yes.
Okay, so Tonya actually did me a lot of favor because pretty much what I wanted to do is it felt like she actually had, an insight in my own presentation. So I'm gonna sue her for copyright. That's it. All right, so I'm just gonna quickly run us through the simple facts you should be conversant with. So when we talk about diabetes, just like the amazing presenter already made you guys to understand, is a chronic problem. So chronicity means it's a long-lasting health problem, and it affects your whole body. So in the simplest layman understanding, diabetes is a condition that affects how your body turns food into energy. The original design of your body is to turn all the food you will consume into energy. Now, majority of the food you will eat today will end up being converted to sugar, which we'll call glucose. Now, when this sugar is converted, it will now further be released in your bloodstream. So I wanted to follow the sequence. If you understand the sequence, then you can understand where the problem is coming from. So you eat your akamo or you eat your swallow. Eventually, it will be broken down into the simplest unit, which is your glucose or your sugar, and it will be released in your bloodstream. Now, when it gets to your bloodstream, that's when the pancreas, so the pancreas is a special organ that actually releases the insulin. Releasing the insulin, producing the insulin is just one of the functions of the pancreas. Now, insulin is at the center of everything, management of the food we eat. Now, if everything goes okay, the insulin that will be produced by the pancreas will act like the key. So the insulin will just come in and say, you know what? Now we've got all this sugar. Now we've got all this glucose in the blood. What do we do next? It will start driving the sugar and the glucose into the body cells. When it gets to the body cells, it will convert them to energy. Then you will be able to perform your function. So the reason why you guys saw us up today is because we had food we had in the system, or we had stored food that produced the energy that gave me the ability to talk. Now, when you have diabetes, it's not going to happen that way again. Now, your body, for some reason, if you have type 1 diabetes, so I wanted to make this to also be very simple. Broad spectrum, we have two major types of diabetes. The first one, which Tonya already mentioned, is called insulin-dependent diabetes, type 1. Insulin dependent in the sense that your body, for some reasons, the pancreas refuses to perform its role, so you're not producing insulin. So it's insulin dependent. Type 1 is used, type 1 will require management with insulin. Type 2 is insulin independent, though we can still use insulin if the oral hypoglycemic fails to perform their role. So you need to understand the stepwise approach in managing all this. So when you have diabetes, your body is either not making insulin at all, or it's not making enough, or the insulin that it's making is not well used. The body refuses to interpret the insulin properly. So when there is no enough level of insulin, or the cell stops responding to the insulin. So two things. You're not producing insulin, or the one you're producing, the body is not responding to them. When this happens, you will have accumulation of all this sugar, of all this glucose in your bloodstream. When they get to your bloodstream, they will begin to do damages. Unfortunately, when they are doing these damages, some of them will be asymptomatic. Asymptomatic means you might not really have the signs and symptoms that Tonya mentioned, but they can go to your heart and mess your heart up. They can go to your vision, mess your vision up, mess your kidney up, mess your liver up, mess your brain up. So any part of your body can be damaged by excessive sugar in your blood. So the reason why you have excessive sugar in your blood is because there is no insulin to drive them to where they need to go and produce energy. So they just relatively stay there and start causing damages. So what are the other terms you need to be conversant with? We've already mentioned type 1 diabetes. So in type 1, the body does not produce enough insulin, which is the hormone that balances the blood sugar level, which I've mentioned. So there is no way to prevent type 1 diabetes at this time. So type 1 is grossly autoimmune. So autoimmune means your body, for some reason, is now fancying you as the enemy. So your body begins to fight you. So in type 1, no insulin or completely absence of insulin in your body. In type 2, the body loses the ability over time to use the insulin. So it's possible the insulin is there, but your body has become insensitive to the insulin. Now, in some people with type 2 diabetes, when they go about modifying their lifestyle, like healthy eating, like staying physically active, like having good sleep, like drinking water, like avoiding smoking, like avoiding alcohol, they can reverse. It's called reversing. It's not cure. There's a big difference between reversing and cure. So if you have type 2 diabetes and you do better, over time, we can tell you, okay, you know what? You used to take this 3 times in a day. We just want you to take it once in a day. Or over time, we'll tell you, you know what? You're doing good. Just keep doing what you're doing. Stop taking any medications for now, but we have to monitor you. Now, from current research, it shows there is a connection between depression and anxiety among young people with diabetes. So remember, the topic for today is not just diabetes in the adult population. It's how diabetes can affect mental health in youths. So from current research, there are 2 important mental health problems that can adversely affect youths that develop diabetes: depression and anxiety. So I needed to focus on depression and anxiety. Now, from this research, people with diabetes are twice as likely to have depression when you compare them to people that don't have diabetes. So the fact you have diabetes places you on a very high risk of developing depression, of developing anxiety, and also a couple of other mental health problems, including ADHD, attention deficit hyperactivity disorder. It doesn't mean that, oh, once you have diabetes, you begin to develop all these things. People are wired differently, but there is a connection between developing diabetes, especially in youth, with anxiety, with depression. Now, how does diabetes and depression, kind of interrelate? Everyone over time will feel sad. We all feel sad. We all feel down. Some days we feel high. Some days we feel low. We are all out there. At some point, we've all had mental health problems without even knowing. But over time, depending on your coping mechanism, depending on your social capital, you can actually be able to fare better. But people are wired differently. So some people can fare better, some people can fare differently. So it depends on what you do when you have all those things. So it's normal part of life to feel sad, to feel disappointed, to feel good, to feel down. It happens. Now, if you have long periods of sadness, anxiety, hopelessness, and even sometimes suicidal tendencies, it's possible you have depression. Now, depression is not something you give yourself. Oh, I'm depressed. No, that's not how to diagnose depression. If you notice, when Tonya made our presentation, she gave us a questionnaire. So we have to survey a questionnaire. We have to ask you some questions. We have to look at a couple of symptoms. We have to look at a couple of other things before we will finally say, oh, you might likely have mild depression, moderate depression, or severe depression. It has to be clinically diagnosed. Now, if you have diabetes, you are more at risk of developing depression. And depression can also predispose you to developing diabetes. So they have a love-hate relationship. So one can predispose you to developing the other, and the other one can predispose you to developing the other. So diabetes can be quite exhausting. It can be overwhelming. So it can cause you long periods of being low. As many as 40% of people with diabetes, especially youths, confirm they struggle with their psychological well-being since they became diabetic. For example, in Nigeria, we believe that, oh, once we go to church, once we pray, once we feel we are holy, then we are not going to develop problems. So when we eventually develop medical problems, we feel so down. So the question will be, why me? And we are easily drawn to look for people that cause this problem. So there are possible some people that might have poorly diagnosed or undiagnosed diabetes that caused a lot of problems, blindness, stroke, or amputation of a leg. The first thing that will come to our mind is, oh, someone in the village did this to me. That's not true. It's possible you have diabetes. So we know there is a relationship between diabetes and depression, and it can be very difficult to manage. So remember, you are not alone. The essence of this FACEYOUth seminar is to give you all the information, to give you all the help you need so you can cope. Diabetes and depression share some symptoms together. Now, I'm going to mention a couple of them. When you're easily tired lately, when you sleep a lot, or when you suddenly stop sleeping, when you have difficulty concentrating, it's possible you might have diabetes. It's possible you might also have depression. It's not for you to diagnose. You need to go to your doctor. We need to make the appropriate diagnosis. So it can be difficult to know whether your symptoms are being caused by depression or diabetes or both. The only way to know is to go to a good doctor. We make the appropriate diagnosis. So the question is, does diabetes cause depression? And can depression cause diabetes? The simple answer is no. You know, in medical practice, there are two words we don't use, never and always. As of today, we don't know categorically the exact cause of type 2 diabetes. We know the exact cause of type 1 diabetes. So it's still a work in progress. And there is no strong evidence to support that once you're depressed, you're going to develop diabetes. But they can affect each other. So diabetes doesn't directly cause depression, but the nature of diabetes can be a factor in developing depression. Now, it's a very tough condition to deal with, diabetes, because it's always going to be present. And it can be very exhausting, particularly with all the extra decisions you have to make, lifestyle modification, and of course, it's expensive to manage on top of the stress you're going through every day. So it can cause a lot of problems. So if you have depression before you develop diabetes, definitely it's gonna make your depression worse. Now, if you have diabetes and you develop depression, your depression is also gonna be worse. So any which way, the key word is to prevent developing both of them. For the ones we can prevent. Type 1, you cannot prevent it. Type 2, you can prevent it, because in type 2, if you're classified as pre-diabetic, it means if you do the right things, we can prevent you from moving from pre-diabetes to diabetes. Now, from previous research, it actually shows that people that have type 1 and type 2 diabetes are more likely to experience depression compared to those without diabetes. So the fact you have diabetes, whether type 1, type 2, type gestational, thankfully gestational will go away after delivering your baby if you're properly managed. Now you have a likely higher risk of developing this. Now there's a particular UK study that revealed that depression can play a direct role in increasing the risk. So there's a difference between risk and cause. That someone had a risk factor doesn't mean it's the cause. So diabetes can be a risk factor to develop depression. Depression can be a risk factor to developing diabetes. So the research finding highlighted the effect of depression on your body mass index. So this is where the conundrum starts. Your BMI is a measure we use in checking if you have a healthy body weight. So there are 3 categories. If your BMI is below 18.5, it means you have underweight. When you have underweight, you're going to have some medical problems. We don't want you to be underweight. The healthy BMI is from 18.5 to 24.9. This is where we want it to be. This is where your body weight will be okay. So to calculate your BMI, you need your body weight, you need your height. I'm not going to bother you with the formula now, but once you punch your number and you're in overweight, we don't want it to be there. We want it to be in normal range. Now, when your BMI is from 25.9 up to below 30, you have overweight. Now, when your BMI is above 30, you have a problem. You have obesity. So we notice that people that develop increase in their BMI will likely be predisposed to developing diabetes. And when they develop diabetes, they can be prone to developing depression. So the research also pinpointed a couple of other genetic stuff, which I'm not going to bother you guys. So over time, we discovered that something genetic might play a role in how insulin is produced or how we can cause inflammation in the brain, in the pancreas, and fatty tissues in the body. Don't worry about it. Now, the changes in your body will show how depression could easily increase the risk of developing type 2 diabetes. So there is obviously a relationship between depression and type 2 diabetes. It's very complex, but over time, as the studies are ongoing, we'll keep noticing the differences. So the research on type 1, type 2 diabetes is currently ongoing, but just know that when you have one, it can affect the other. Now, how does depression affect your diabetes? Of course, I've already mentioned that depression is a serious mental health problem. So it can affect anyone. There is no age, there is no race, there is no social status. Anybody can be depressed. You can have all the billions in the world and you're depressed. And you can have abject penury and you can be depressed. But there are some social, economic factors that can predispose you to developing depression more. So it can affect any culture, background, family history. It can cause you to feel bad about yourself, your life, and your relationships. If you experience one or more of the symptoms for longer than 2 weeks, please talk to your provider. Depression can affect your diabetes. A few symptoms of depression can have direct impact on managing diabetes. For example, if you notice that previously you're very sociable, you used to hang around people, you used to go on social media, you used to call people, then suddenly you do not want to do anything else. You don't want to see anybody. You don't want to talk to your mom. You don't want to talk to your dad. You don't want to talk to your siblings. You don't want to talk to your friends. There's a problem doing that. So you might not be able to manage your diabetes alone. Diabetes is a medical condition that everybody in the community will need to show up to manage. You can't manage it alone. You need your mother, you need your father, you need your spouse, you need your friends, you need your doctor, you need your boss to help you manage this, because it's something you're gonna live with over time. So it might mean you're not taking your medications appropriately, or you're not checking your blood sugar, or you're missing your medical appointment, or you're ignoring the health problems. Because when you have depression, anything anybody is saying is not making sense to you. So you might not even be able to take your medications. You might not be able to check your blood sugar. You might not be able to go to work. So everything will just be low. You can even feel like taking your life. Diabetes can make you to take their life if they feel that the world is coming to an end. Now, all this could lead to complications. If you notice you're feeling down often for a longer period of time, if you wake up a lot at night to pee, and you're not able to get out of bed, if you feel tired more often than not, these are new things you've started developing. It can affect your ability to exercise, which can also help you managing your diabetes. If you notice you've taken to food as your comfort zone, so some people, when they are not feeling good, they take to overeating. What happens when you overeat? You're further gonna make your BMI to be going up. What happens when your BMI is going up? Possibility your blood sugar level is going up. Possibility you're developing diabetes. So it's a vicious cycle. Some people will also do the opposite. Some people will not eat. They might be bulimic, they might be anorexic. So not eating enough might also lead to hypoglycemia, which I told you guys. So it's a very complex thing. So if you feel bad about yourself, if you're worried about letting your friends to know, or your family down, or you caused this by yourself, or maybe because you had a boyfriend or a girlfriend growing up, then God is deciding to punish you and you want to take your life, my sister, my brother, you likely have a mental health problems. If you're easily distracted, or you're struggling to concentrate, you know that you need to take these exams to pass, to get to the higher level, but you don't even care about the exams, it's possible you might have depression. If you're feeling restless, easily angered, jittery, if you move slowly or not wanting to speak to anybody, it's possible you might have depression based on the diagnosis of diabetes. If you're thinking that you will be better off dead, or if you have suicidal tendencies, please, you are not alone. Make sure you seek help you need. So you can see that depression can make you feel self-destructive. If you feel like you're better off dead, please call someone you trust. They will get you the help you need immediately. Don't always spiritualize suicide and other things, especially Nigerians. We believe that anybody that commits suicide is going to hell. You don't know that. You don't know their story. So let's stop all those stigma. So though your feeling low might be unpleasant, it's not going to last for a very long time if you seek the appropriate help. So everybody gets sad now and then. But if all these symptoms are overwhelming, please touch base with your GP. So your GP can help you to do better. So coping with diabetes can make depression worse. So there are a lot of reasons for this. You feel guilty for not managing your diabetes properly. You are not wanting to inject yourself or test yourself in the public, because when you have diabetes, depending on the technology we use in managing you, you might have a need to use what we call glucometer. So your glucometer means you prick yourself, you check your blood sugar level at that point to see what you need to do. Or you're feeling ashamed of the fact that you have diabetes. My people, anybody can develop problems. Don't be ashamed of your medical problems. Matter of fact, when you have a medical problem already diagnosed, you are ahead of time, because there are so many people that might be judging you that might not even know they have worse problems. For example, if you know you have diabetes or you have hypertension, you already know. You've already started taking your medications. The people that are judging you are going to churches. They are taking herbs. They don't even know what's going on in their body. So if you form the habit of seeing your doctor regularly and we discover you have the problems, we've actually helped you. So it's important to follow all this so that over time, we can be able to co-manage the difficult cycle of diabetes and depression. So take care of one condition, and by taking care of one condition, you can actually take care of the other condition. So there are a lot of different things you can do to help yourself. We are always here to support you in FACEYOUTH based on anything you need. So for today, if you happen to be diabetic, or if you're struggling with your mental health, or if you have depression, you can get help from FACEYOUTH today. You can place a call to them and they can connect you to the care you need. So what you can do to lift your mood, I'm talking to the youth right now. I'm going to give you these specific tips. Whatever I'm going to tell you now will help you to lift your mood. When your mood is lifted, no matter what's going on in the world, you will be fine. So find the right treatment for you to help you manage your depression and diabetes, which you have to understand will take time. It's not going to go overnight. So there are a few things you can do to help you lift your mood. And I'm going to mention them. Number one, talk to your doctor alone. Talk to your health professionals like Tonya. You can see there are interdisciplinary approach to diabetes. Not only doctors that manage diabetes. You can see she knows her stuff. Pharmacists can manage your diabetes. Nurses can manage your diabetes. People in the health sector can manage your diabetes. So talk to them. Your doctor's office will help you to approach your diabetes by making sure that the team of highly trained advisors will help you appropriately. They know a lot about diabetes and depression. They will help you with counseling skills. So talk to your doctor. Now, of course, you have to talk to your friends and your family and your peers, the ones you trust. I wouldn't want you to go there and be disclosing your health condition with people that don't actually care about you. So if you have genuine friends, if you have good relationship with your family, talk to them. Sometimes when you talk to people, you feel better because when they know what you're about to talk to them and when they understand and love you better, you will feel better. So talk to your friends, talk to your family, be careful with your peers because some of them are actually, there are some people that might be happy that this might be happening to you. Now, be mindful about the food. There are some food that will also help you to improve your mood. So food can be a good part of your life. There are some foods you can eat as a diabetic, and it will still give you that good feeling that will give you a good sense of accomplishment. So food can also play a role, but it must be the right kind of food. Now, of course, you have to move. Exercise is huge in managing depression. Exercise is huge in managing diabetes. So whichever way you look at it, when you move for at least 30 minutes every day, it's going to help you to manage your diabetes. It's going to help you to manage your depression. So it has loads of positive benefits, including managing your body weight. And of course, if you manage your body weight, you're going to lower your blood sugar level. And when you lower your blood sugar level, you're going to allow the insulin to be more effective. So it can really help you to improve your mood. It can help you to motivate yourself. It can help you to concentrate. So having depression means the last thing on your mind is to get up and move. But if you have people that will encourage you, when you move and you release your endorphins, you're going to feel better. So exercise is huge. So please move for at least 30 minutes. When you do this, you're going to notice a huge, very important change in your life. So to summarize, the fact you have diabetes today, it's not the end of the world. It's actually the beginning of making sure you fulfill your longevity exactly how God planned it for you, especially the youth. So if your father, if your mother, if your siblings, if your auntie and your uncles currently are battling with diabetes, possibility you might have it as a risk factor is very high. So the key word is to modify your lifestyle so you can prevent it. Now, if you have already been told you have pre-diabetes, that's a warning sign. That's a danger sign. You can break even. And of course, if eventually they told you have diabetes, so what? The world is not going to come to an end. So the earlier you seek help, the earlier you can get the help you need, and you'll be perfectly fine. Thank you guys for coming.
Wow. Thank you so much, Dr. Chudi. This has been very enlightening. It's an eye-opener for me and I'm sure I'm speaking for everyone on this forum here. Thank you so much for that. Yeah. I don't know if anyone has any questions from Chiamaka. Thank you, Dr. Chudi, for this awesome presentation. It's been really, really interesting. You've broken it down. You, Antonia, are very good at breaking things down for non-medical people, which, a lot of us are here, and it's been really good. Thank you so much. So I'll just check through the chats now to see if anyone has any question for you. So it's just thanks. Tonya, do you have something you want to say?
Yeah, I was just going to add something to Dr. Chidi. That was really good. Thank you. I think we were both sitting down together and rubbing heads together. There was something you said about exercise. The only thing I was going to say is, in addition to that, is if someone is already diagnosed with diabetes here and on insulin, and you're exercising, please make sure you check your blood sugar levels before you exercise. If possible, during the exercise. If it's longer than 30 minutes, and after, because there are implications of that in terms of how your blood sugar level drops. So it's good to exercise. So if you're with someone that is diabetic and on insulin or certain types of drugs, and that would drastically lower their blood sugar levels, we always say if they're going to exercise, it's good that you're taking them along because they need to move, but just make sure that you're not dragging them for a whole marathon and then telling them you need to keep up. And then when they're telling you they're weak, that you don't stop to think they're on insulin. And then as a result, they might have hypoglycemia. That's the thing I wanted to add.
Okay, Tony, now you're on the floor. I'm gonna default to you. Someone asked about ketoacidosis. Please, can you break it down for them?
That's so diabetic ketoacidosis is what we talk about. It's mainly a complication of diabetes that results from you have chemicals in the bodies called ketones, and it's increased levels of this chemical in the body, ketones, that can actually lead to diabetes, a serious problem, in the sense that the body stops. I'm trying to find a simple way to actually break it down. It's more common in people that have type 1. However, the body starts to break down or release excessive amount of ketones, which is within the body, and can lead to certain symptoms that are similar to diabetes. So it can lead to excessive thirst, frequent urination, fatigue, and or vomiting. Now, we say to people that, like, especially when their levels are high, certain patients that are on insulin or type 1 diabetic, oftentimes here in the UK, we tend to diagnose type 1 diabetes when they have diabetic ketoacidosis because there's a lot of ketones in the body. So ketones are generally good, and you have these people that it has this function, but then you have people who are doing ketosis diet. I'm not going to go into that. But when you start having this excessive ketones, you're peeing a lot, you're urinating, which are the forms of diabetes. But then when it's associated with abdominal cramps, nausea, vomiting, and your blood sugar levels. So in the UK, we use millimoles per mil, but in Nigeria, they use milligram per deciliter, and I think that's the same in America. When your numbers are like the 300s, the 400s, the 500s, in the UK, that's like 20 something, 30 something. We will give you, so your glucose monitor, some of them have the avenue to have ketone monitors in them, and we get people to check their ketones. If their ketones, this is now becoming a bit medical, but if their ketones are above a certain level, then it's a sign that it's actually a life-threatening case. They need to go straight to the hospital because it's actually life-threatening. So it's mainly a breakdown and excessive of these chemicals in the body that leads to diabetic ketoacidosis. I'm going to throw in again, there are certain patients that are on certain medications because, like Dr. Chidi said, we have diabetes, but diabetes and hypertension are brother and sister, like I like to say. And sometimes they work hand in hand. You can have diabetes, you have high blood pressure. Now, there are certain medications that we use to treat diabetes, and we also use certain medications to treat hypertension. These medications are good. However, if someone starts to feel very unwell, so um, they start to have like they have fever, or we call them sick day rules. They're not well in themselves. We advise them that you need to stop these medications. So things like metformin, things like Ramipril, all these certain drugs that act on the kidneys. They protect your kidneys, but the time when you're unwell, because when you're seriously unwell, they can have a problem with your kidneys. It can cause your kidneys to go into overdrive. And these kidneys are also trying to regulate this medication. So we say stop it for like 3 days. Don't stop it for a long time until you start to feel better. When you feel better, then you go back to these medications. So these are the advice that we tend to give to patients. We don't stop your insulin if you're on insulin. You continue your insulin because we teach people how to adjust their insulin if they're unwell because they might need to increase it, they might need to reduce it. But it's not something that you as a layman on here would need to do. You would need to speak to diabetes specialists like us, and then we'll be able to tell people what to do. I don't know if I explained that.
Yeah, correct. You actually made it very, very simple. And anybody that doesn't understand it, I don't know how else to explain it. But here's the deal. The simplest way to explain ketosis in regards to diabetes, it's the fruity breath. So people that produce what we call ketone bodies. So I'm not going to bother you about the medical and the academic terminology, but just know that people that have diabetes tend to produce a lot of what we call ketone bodies as part of those whole chain of the diabetic stuff. And that's a signal that you might likely need professional help, or it's not poorly, or it's poorly managed. So ketosis, when you're getting yourself at the level of ketosis and all that, the presentations Tonya mentioned can also lead to ketosis coma. So you can go into coma. So if you see someone that suddenly collapsed because he has hypoglycemia, because there is not enough, because if you don't have enough energy, if you don't have enough sugar in your body, you can go into coma, you can collapse because you don't have enough energy to power you. So it's not all the people that collapse that people in the village, gave something that killed them. So the point I'm trying to make is, when you notice certain things you don't understand, don't always go looking for your own explanation. Go to your doctor, because diabetes is an interdisciplinary medical condition that so many people have to come in and manage. If we're giving you glucometer, we need to teach you how to use your glucometer. Thankfully, lately, there are some devices you can place on your body and it can monitor and tell you what to do. And I love the fact that, Tony also mentioned about, going for your exercises. So we also encourage you to, you might have a need to drink a lot of water, which is called polydipsia. So when you have that need, you still need to drink the water. So the fact you go to urinate frequently and you don't feel comfortable about it, you don't want to be dehydrated when you have diabetes. So the point I'm trying to make is to make sure it's a holistic approach in managing yourself. Don't be isolated and thinking, I'm going to stop this, I'm going to stop that, because our people are very good in going somewhere and someone will tell you, don't worry, stop this, take this, and everything will be perfect. Especially our people that are Christians, we tend to, lay all this burden on God's feet as if God is going to come down to fix what we need to fix ourselves. Prayer works, but when you have prayed, you have to also modify your life so that your prayer will work. Okay.
Yeah. I have this thing on TikTok that I keep watching people eating and saying, my God is a calorie burner. And I know it's a joke, but they're eating it and saying it's a calorie burner. Yes, God is involved. And I always tell the Christians that come into my clinic to say, I'm a Christian. I love God and I do everything God-wise. But both my parents are not here today. They had diabetes. So I know my risk factor. I don't come from a very slim family. I know my risk factor. So I check my blood sugar levels every 6 months. I have a blood test on Monday. I'm going to the doctor to check my blood sugar level. My brother had his blood test. He was told he's pre-diabetic. So I know my aunties have had amputations. I've had people. So it's in my family. So I'm not saying, so when I get the passion, it's not because I'm just studying it, because it's in my family. So I know the complications that are there. So I'm looking after myself. So yes, I like to eat Gary and I like to eat this, but I eat it with wisdom. And sometimes you can modify what you eat. So you can have your Gary, a smaller portion, but have it in the daytime. Have it in the afternoon. In the evening, eat something lighter because you're not moving around. You're just gonna sit in front of the TV. Some people eat Gary in the morning and people go, why are you eating Gary in the morning? They're burning that Gary in the morning.
Calories, correct.
So yeah, so it might be easier to switch it and have it. To the English mind, they're looking at me like, what are you talking about? But I say to people, eat your rice in the morning, obviously in moderation, because you can burn that calorie. But when you get home and you heap your plate and then you're chilling, you're like, life is good, one life, everybody says.
I know.
But not necessarily. Yeah.
You're slowly going down.
Yeah.
I know.
There's another question there that says, does insulin cause weight gain? Naturally, it depends on the amount of insulin that you're on. The answer is yes, insulin can cause weight gain. But then again, a lot of people want to stop their insulin because they feel like, oh, I'm putting on weight. I have a lot of patients that say to me, I'm not taking this insulin anymore. And I say to them, listen, you don't take the insulin. We always look at, it depends on the weight gain, because again, we talk about diet and lifestyle a lot. But there are certain people, Dr. Chidi, you would know this. I've had patients, the most I've got at the moment as a trouble for me, and I'm working with a consultant endocrinologist, is that I have somebody on about 200 and something units of insulin, almost 300 units of insulin. It's a lot, and she I think, has been misdiagnosed. So the consultant agrees with me that we need to go back to the basics and we need to unpin. So that I can talk about diabetes for weeks. There's so much that we do when we teach people about diabetes, and there's a lot from that. The answer is yes, it can cause weight gain, but it doesn't cause weight gain as soon as we put you on insulin. But there are dietary things that we can do alongside and to be able to avoid that.
Yeah, let me also chip in. Nothing happens in isolation. All the medical problems we have, they are all connected. So someone that has diabetes, hypertension, and obesity will have a condition we call syndrome, metabolic syndrome, okay? So here's the deal. I don't want us to be fixated on, oh, because they told me insulin might likely have an adverse effect or side effect of little weight gain. If you live an active life, you can take all the insulin you have, you won't even know. There are some people that also might look, slim and all that. They can have diabetes. So stop having this mental fixation that, oh, it's only people that are big that can develop diabetes. No. People that look healthy can develop diabetes. So, but work with your provider to know what works for you. And remember, there are some other medical problems that can also predispose you to adding body weight. For example, if you have thyroid disorder, especially hypothyroidism, so they can also complicate your ability to retain a lot of fluid in your body. And if you're someone that is not active and you're eating all the nkwobi and all the stuff in your community, and you're taking your insulin, definitely you're going to add a lot of body weight. So it's not a one-time, one quick thing, but it's something that can happen if you're placed on insulin. Okay, we have a couple of doctors in the clinic today, so I don't know if any of them want to contribute. You can unmute yourself and they can contribute. And if you also want to ask us questions using the video or the audio, feel free to do that. Sometimes it's better to hear from people directly. So if you want to do that, you can raise your hand.
Yeah, we have some questions still. What kind of vitamins are best for someone with diabetes?
Okay, I'm gonna come in there. The good thing about vitamin is the fact that it's multivitamins. Okay, so we generally encourage you to augment things you're not naturally getting from your food. So depending on what you want to achieve in life, like for example, if you want to have a baby, the type of multivitamins will tell you to concentrate on is prenatal multivitamins, because there are some fortifications you will need more. Things like folic acid, things like your iron, things like your vitamin D, things like your calcium. But generally across the board, I always tell my patients to always fortify themselves with daily multivitamins. Now, there are specific multivitamins for gender. There are specific multivitamins for age, and there are specific multivitamins for particular medical problems. So everybody in the community, everybody in the family is encouraged to fortify and augment what ordinarily you're not eating properly from your diet.
Yeah, I'm not really going to add much to that, but the only thing I would say is, obviously, as well, if someone already has diabetes and is on certain medications, so for example, metformin, recent 12 in small intestines. So it has its place in diabetes. But what we do is, as a yearly check, when we do your yearly bloods, we will do your B12 levels and we do your folate levels.